your family, your friends, your healthcare team, and your community, you can take charge of your diabetes. What the hell's my community going to do?
Got to exactly.
How about you take control of your health? Quit stuffing your face with all the wrong food and go get some exercise, drink more water, and have more fiber. And how about you cure your diabetes? So see, they don't talk about that. There's no cure. It's like, let's get in a community group, let's have a support team, let's all cry and hug each other and live with our disease for the rest of our life. And that's not a joke. That's what they talk about right here. They tell you to talk about your feelings. They talk about my feelings. I mean, how about you show me what caused it and show me how to fix it? So they talk about all the signs and symptoms. They misrepresent what type 1 and 2 is. It says type 1 diabetes, blah, 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 you must be injected with insulin to live. This is also not true. And it's not true because, if you exercise, your body doesn't need to use insulin when you're exercising. So one of the best recommendations is right after you eat something, go and walk for 10 minutes. You still need to be able to make some insulin, but anyways, most people have type 2 diabetes, and it's where your body keeps making insulin for some time, but it just can't use it very well. Like shucks, like it's not your fault. It's just a disease that a lot of people get. But this is absolutely not true, because it's not that your body can't use it well. It's that your body gets desensitized to it because of having a pathological diet for so many years. This is why they used to call it adult onset, because you used to have those pathological choices for 10, 20, 30 years before it would really take effect. Now we're seeing this type 2 diabetes in kids because our diets are so incredibly bad. And even little babies are being fed formula that's loaded with high fructose corn syrup. Okay. Horrible. So it's just happening much, much earlier. Okay, let's talk about some more risk factors. A family history of diabetes. Got to be genetic. It's not genetic. A lack of physical activity. That plays a role, but again, it's not the cause. Overweight plays a role, but not the cause. Unhealthy diet. Examples. Foods high in fat or eating too much. It gets me so mad. That's so 100% wrong. And then being Asian, Pacific Islander, or Native Hawaiian. Right? Hey, you know what? I mean, what a bunch of racists.
Yeah.
Let me ask you a question. How much diabetes do you think the Native, Hawaiians had before Whitey showed up? None. None. It's called the 20-year rule. Whitey shows up and gives you sugar, and in 20 years, your people have diabetes. This has been shown epidemiologically all around the world. And then the next generation has more and more problems. Family history. So they're talking about how it's genetic. It's not genetic. Because if it was genetic, it wouldn't be reversible, 1. And then 2, so what about type 1 diabetes? That's got to be genetic. It's got to be genetic because, it's just got to be. Because, you're born that way. That's why they say is that you're pretty much born that way. It's child onset, so if you're born that way, it's got to be genetic, blah, blah, blah. Here's why it's not genetic, okay? Darwin was wrong about a lot of things, but one thing he was right about was natural selection. That does play a role. That your genes that make you more fit to reproduce so that you can outcompete the competition for reproduction, those genes are passed on to the next generation. Okay, the problem with type 1 diabetes is that if you don't get Medicaid, if you don't get insulin for it, you're going to die as a kid. You'll never, ever make it to your reproductive years. So if it was genetic, it would be wiped out within 1 generation, 2 max. It can't be genetic. It's just like the whole, gay and lesbian argument. I don't know why I keep reading Time magazine. I hate it. It's because my wife has a subscription. But I was like talking about how this cardinal says, of course I don't discriminate against, gay or lesbian people being in the church or, in the papacy. I wouldn't discriminate against somebody because of the color of their skin or this or any other thing that they can't choose. These people are born this way. Now, I'm not talking about whether or not, homosexuality is right or wrong or anything else. Just the argument that I was born this way. That's not true. It's a choice. If you were to take all the homosexuals on the entire planet and put them on an island, they would be gone in 1 generation. They don't reproduce, okay? And so it's not, you were born this way. This is a choice. And it's the exact same thing with diabetes. Diabetes is a choice. Now, I say that only, it's not in the sense that a lot of people don't know, but, your diabetes is a result of how you choose to eat. when you learn the right way to eat, you won't get diabetes, and you can actually reverse it. And so that's important to understand. So it is not, has nothing to do with genetics or a family. Now there's a family history because families eat the same, but it's definitely not genetics, and it's definitely not, you know, your race or your ancestry, because, you know, none of these people had, you know, diabetes until Whitey showed up. So an unhealthy diet, foods high in fat and eating too much. This absolutely blows me away, because eating fat has nothing to do with it, and eating too much doesn't have anything to do with it. Portion control is wrong. It will never ever work. If you starve yourself, if you use portion control, you're always going to be hungry. That's going to throw your body into a state where your body's going to want to pack on weight, because it goes into starvation mode. Plus, it's never sustainable. It's never ever sustainable. You're not going to be able to, you know, resist your urges for the rest of your life. It doesn't work. You should never ever be hungry. You should always be able to eat as much food as you want. You have to eat the right foods. How many people get fat from eating 2 pounds of broccoli?
Right.
Oh, I can't eat 2 pounds of broccoli. I know, because you're a sugar junkie. I mean, let me tell you what, nobody gets fat from stuffing vegetables down their face, unless it's a potato or French fries aren't vegetables. Potato, I don't even consider it a vegetable. Okay, it's a starch, it's not a vegetable. But the point there is, and they say food's high in fat. The Eskimos have a diet that's 90% whale blubber. How much diabetes do they have? None. None. It's not fat. And here's the thing that really gets me. You remember back in the 80s when they started telling, because back in the 80s there was a problem with heart disease, and diabetes was increasing, and obesity was starting to be a problem back in the 80s. So they came up with these great dietary recommendations of, hey, starve yourself, limit your calories, you got to stay away from fat, because fat's the culprit. It's totally evil because it's high in calories, and you got to eat more carbohydrates because carbohydrates have less calories. And since the inception of those recommendations, what's happened? Did diabetes skyrocket, or did it skyrocket? Heart disease went up, AED went up, everything got radically worse, okay? But I said all that because back in the day then, frozen yogurt used to be really, really popular, because frozen yogurt didn't have any fat. It was better for you because it was heart healthy. You know, it had all the sugar, but it didn't have any fat because it was frozen yogurt, right? So here's the thing. What has a higher glycemic index? What makes your blood sugar spike more? A higher glycemic index is how high your glycemic index is of the food means how high your blood sugar spikes. You want to stay away from high glycemic foods if you're diabetic or if you want to avoid diabetes. Which one has a higher glycemic index? Frozen yogurt or ice cream? Frozen yogurt.
Frozen yogurt,
because the difference is that the ice cream has the fat in it. The fat helps to meter the glucose in, the sugar in more slowly, and so it has a lower index. And so, they're telling you to stay away from fat, but if you're staying away from fat, eating foods that are low in fat are high in what? Sugar. It's got to be, because you take the fat away and it tastes like, CRAP or cardboard. And so what do they have to do to cover it? They have to load it full of sugar. So anytime you see anything that's low in fat, it's high in sugar. Okay, so not only have you increased the sugar, but you've increased the rate at which the sugar is going to be absorbed because you took the fat out of it. And so what happens? Diabetes goes up, people get fatter, plus they're starving themselves, so they're hungry, so the food that they eat gets turned more into fat. That's why this stuff never ever works. Okay? And so, but that's what they tell you. It's like, oh yeah, people that eat too much fat, they're going to get diabetes. Like, no, they're not. People that eat too much. No, they're not. Absolutely wrong. Salmon, loaded with fat. Fish, good healthy fish, loaded with fat. Okay, you ever know anybody that got fat from stuffing their face from fresh fish all day long? All day long. You can take it out all day long. All the broccoli you want, smothered in butter. You can eat that until you puke your guts up. You don't get fat from that. I'm not saying you should do that. That's not necessarily healthy, by the way. I just making a point that you're not supposed to be hungry, and you are supposed to eat fat. They tell you to stay away from fat like it's a disease, and they tell you to eat carbohydrates like it's crazy, when the reverse is true. Your good, healthy fats are absolutely essential for so much of your regular physiology, whereas your carbohydrates are completely non-essential. Your body can make its own sugar.
Right.
Crazy. Diabetes control. Operative word there. Control. Not correct, not cure. Control. Okay? They give you their recommendations. Eat 3 meals a day or 5 to 6 smaller meals. Pay attention to your food. Limit your food portions. So again, starve yourself. Don't eat what you want to eat. Choose foods from 3 or more food groups. Example, starch. The first thing they give, they're telling diabetics to eat starch as the very first example, and they say there's 3 or more food groups, and you see the food group pyramid, and they say, the pyramid's totally wrong. Like at the very top, you should have sugars and sweets, and you should limit that. You should have, 5 to 6 servings of fruit and vegetables, and then, you should have 2 to 3 things of protein, and then under that is carbohydrates, 6 to 11 servings of carbohydrates a day. They tell you, and diabetics especially, 60 to 70% of your dietary intake should be carbohydrates, which is sugar. Oh my God! No wonder these people will never ever get better. And that's what we talked about, is once you start following the medical recommendations for medical nutrition, they tell you to eat 60 to 70% carbohydrates. 2 out of 3 things that go into your mouth are carbohydrates. You will never ever get rid of your diabetes. You're just going to become more and more insulin resistant as time goes on. You'll never ever get better. And so they're telling you to do all the wrong things. Choose foods lower in fat. We talked about that. And then limit sweets and alcohol. What sounds wrong with that? Anything sound wrong with that? How about eliminate?
Yeah.
What's wrong with just saying stop it, avoid it like the plague? My God, you're killing yourself. What's wrong with telling the truth and say, you know what? You're addicted. This is a psychoactive poison. And if and the reason you have such a hard time giving it up is because you're addicted to it. And it's in everything, which is not an accident, And so that's what happens. So nobody gets better, A few things about diabetes medicine. Take diabetes pills or insulin injections to control your diabetes. That's a great recommendation for everyone. Got to wear tight socks, like that's going to fix anything, Check your feet for blisters and redness and blah, 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 so you can get another doctor to visit and amputate your leg. And take your medication as prescribed. Here's the thing. If you have the signs that your blood sugar is getting low and you can't test it right then, go ahead and drink some unsweetened fruit juice. Okay, fruit juice is all fructose, which is what is the worst possible thing for you, and it's been pasteurized, so all the nutritional value is gone. So they're saying drink liquid sugar. And then drink some fruit juice every 15 minutes until your blood sugar level is normal. You will never, ever have normal blood sugar level from drinking fruit juice. Now, if a person slips into a coma because their blood sugar is so low, yeah, you might want to get some orange juice and put a little bit in their mouth and see if maybe you can wake them up out of a coma. But that's about it. But they're telling people to stabilize their blood sugar with sugar. It's retarded. I know these diabetic people, they walk around the Snickers bar in their purse because, I got low blood sugar, I got insulin. And this is why the article says that doctors are causing diabetics to die. Doctor-induced exacerbation. Every single thing that they're telling you, well, not every single thing, but like at least 7 out of 10 things that they're telling you to do are going to make things dramatically worse. And the other 3 out of 10 things that they are telling you to do are obvious, and people aren't going to do them. Like exercise. So, or they just give you very vague recommendations so that you don't know how to do it. They talk about signs of high blood sugar, and if you have signs of high blood sugar, what you should do is, go to the emergency room, visit a local clinic, blah, blah, blah. You know what they don't mention? Exercise. If your blood sugar is high, get your butt off the couch and go look around the block a couple times. But no, that's cheap and easy and safe, and that could actually fix something. So don't do that. They talk about how you're going to get diabetic eye disease, so you have to have a regular eye exam so that they can go to the eye doctor and make money. And you're going to have kidney problems, so you need a nephrologist. Of course, there's going to be heart and blood vessel problems, so you need a cardiologist. Just not Dr. Atkins, because his diet's bad for you. You're going to have nerve damage and foot problems, so you need a neurologist. You may need an amputation later in life. And of course, it causes dental disease too, so make sure you see your dentist twice a year. And of course, you got to get vaccinated, because now that you have this, you're more prone to getting flu and pneumonia, so you got to get your double immunization every year. And that's how you can control your diabetes and take charge with the help of your friends, your family, and your community, and a support group.